morning, everyone. So today I'm going to go over the second component of medical safety. We've talked about body mechanics. This one is more focused, though, on probably things that you're aware of, especially with coronavirus. But things like making sure that you as a healthcare worker don't get infected, also injuries. But yeah, the focus is going to be a little bit different today. So we're going to quickly just review what you have learned so far. So you guys should remember what ergonomics are. So making sure that your environment is adapted to basically prevent you from having unnecessary fatigue, like I've mentioned yesterday. And then also, I think in Friday's lecture, that medical professions often require you to be physically active, in decent shape. You're always on your feet, that sort of thing. So it's just important to make sure that you're not causing unnecessary strain, fatigue on your body. So again, this is just review. Making sure that furniture, equipment, things like that are in correct placement, correct height. I think I talked to you, or at least I know I talked to some periods about how it's important to be aware of, like, for you as a student right now, how your computer screen is located. So it should be at eye level. That way you're not having to hunch over, but that's the same thing when you're working as well. Making sure that you're training your employees or are trained in the correct use of your muscles. So just a reminder, your glutes are your strongest group of muscles in your body. So you want to use those strong muscles over, your upper body. Upper body is not as strong as your lower body. Trying to avoid repetitive motions. So kind of like a fun little fact, there are athletic trainers that work in non-traditional settings. So an example of this is there are athletic trainers that work at Disneyland. Obviously, you have athletic trainers that work with like the cast members, like the dancers, the people in the parade, but they actually do also have athletic trainers who are responsible for making sure that the other employees don't injure themselves. So an example of this is I had a classmate who ended up being an athletic trainer for Disneyland, and they were explaining to me that they were working with the people that work at the ice cream shop. So if you're familiar with the ice cream shop, it's on Main Street in Disneyland. Um, the line there is usually really long, and so the employees are constantly scooping ice cream. Well, apparently at this time, they were noticing that a lot of the employees were developing elbow tendonitis. So basically, like their elbow is just like irritated, swollen, caused them pain, that sort of thing. So they weren't able to do their job correctly. The athletic trainers were responsible for teaching them how to properly like scoop ice cream, which I know kind of sounds silly, but that's just something that is ergonomically, I guess, that's an ergonomic correction in a normal job facility. So just being aware of your environment, making sure you're not, injuring yourself, and then just in general, you're trying to avoid those accidents or injuries from happening. All right, so new stuff. Today we are going to talk about OSHA. I don't know if other students are familiar with OSHA, but OSHA stands for the Occupational Safety and Health Administration. So they are an organization that's branched out of the Department of Labor. They basically are responsible for establishing safety in the workplace. So you have OSHA for pretty much every profession. If you've taken any other ROP classes, they might have talked about OSHA for whatever career it is. But for medical, OSHA is responsible for making sure that employees have the proper personal protective equipment. They're responsible for making sure that hospitals, those types of settings, are ensuring that the workers are safe. If we're talking about, I give this example every year. My boyfriend, he is a civil engineer. He is responsible for working on job sites and just kind of teaching the craft. So the workers that are actually building the things that he's working on, how to do things correctly and safely. So an OSHA standard for someone who's working in construction is that if they're above a certain height, they have to be secured. So they have to be wearing like a harness and attached to something. And that's just something to protect the employee so that, let's say they were to lose their balance, slip, fall, they're not going to end up killing themselves. So OSHA is just responsible for ensuring safety in all different organizations. So we're going to focus on the ones, though, that are specific to healthcare. When we talk about healthcare and OSHA, you have the occupational exposure to hazardous chemicals standard, and then the bloodborne pathogen standard. So the first one, when you are working in healthcare, you tend to have to disinfect and clean things frequently because of that. And that's just so that you can maintain a sterile environment. Because of that, you're just exposed to chemicals that could potentially be hazardous if there's too much of it, or maybe you accidentally inhale it, it gets in your eyes, that sort of thing. And then the bloodborne pathogen standard, which we'll get to, this is probably one of the most important ones, but it's just, and we'll get into it more when we cover how infection spreads, but it's how to handle blood and other infectious fluids so that you do not yourself get infected. So that kind of ties in, it does tie into things with coronavirus, although coronavirus isn't bloodborne spread, which anyways, we'll get to it in a moment. All right, so like I stated, the occupational exposure to hazardous chemical standard is just making sure that all employees are informed of what chemicals and hazards are in the workplace. Again, this is just something I have to go over with you guys. When you have a product that is chemically created, they usually will have something on the back just explaining what parts of it are hazardous, what to do if you were to consume it. So again, this is just something that if you plan on working in healthcare, probably in any setting though, if there are chemicals involved, you will just get trained in it. So usually it's like a video and then you have to take like a quick quiz. The next one though is like probably the most important one. This is talking about bloodborne pathogen standards. So even as a teacher, I actually have to do this, but especially if you plan on working in healthcare, you're going to be exposed to blood and other bodily fluids that could potentially be infectious. So again, it's just teaching employees on how to prevent getting infected, and then also what are the diseases that you're trying to avoid. So these 3 diseases, and you will need to remember this, the 3 diseases that are typically spread through blood are going to be hepatitis B, hepatitis C, and then HIV. So I have AIDS right here. AIDS and HIV are the same thing. So in order to develop AIDS, you have to have come into contact with the human immunodeficiency virus, so HIV. So that virus is what causes the condition of AIDS. You can have HIV and not actually develop AIDS. So just think of HIV, is the virus that causes it, and then AIDS is the condition that comes from it. Anytime you are working, and we'll again cover this when we cover chain of infection, but anytime you are dealing with someone, especially when it comes to blood, you have to not pretend, you have to assume that that person is infected with any of these 3 diseases. And so reason why is just, it's better to be safe than sorry. So that's why you will see if you go into a hospital or a doctor's office, they're wearing gloves. You will see that, especially if they're dealing with blood, they will not throw things in a traditional trash can. So this is an example of a biohazard container. So your biohazard containers can be there for different things. You have bigger ones, which are usually used for like if you were to have a lot of blood loss and bleeding, so the patient's bleeding a lot, you do not want to put like a saturated amount of gauze in a regular trash can because someone could potentially touch it, it could spill, that sort of thing, and then you're essentially or potentially spreading more of whatever that disease is. And then also you will see on this image that it looks like a needle. So same thing, needles. You have what are called sharps containers. So if you were to, let's say, administer an IV or administer some type of medication, you are throwing those needles and other sharp objects in a sharp container, because if you can imagine, if you just throw it in a trash can, that needle is going to poke through the trash bag, and then if someone were to touch it, then they could potentially contract any of those diseases as well. So the biggest thing with this is just training people on ways to avoid potentially getting some type of infection that is spread through the blood. This is another thing, and I know it's kind of graphic, but I like to show graphic images. But anyways, MRSA is a type of bacterial infection. This is not a bloodborne pathogen infection, but it is highly contagious. So this is a type of, like I said, bacterial infection. If you ever have what is called a staph infection, Oftentimes, they will use antibiotics to treat it. Somebody who has MRSA, they can treat it, but it's typically resistant to the most common forms of antibiotics. So why am I talking about this? You have to, if you're working in healthcare, obviously worry about contact with blood, but you also need to worry about contact with anything that's infectious. So MRSA is a highly infectious skin condition. So you can treat, if you had a patient with MRSA, you too would want to make sure that you're wearing gloves. Sometimes it's important to wear like goggles, masks, things like that, because this type of skin condition tends to develop pus, and if you're trying to like cut it out, sometimes that sounds gross, but that pus can like squirt out at you, and so you definitely don't want to get that like on your face. But if you think about coronavirus right now too, train those employees that are working in hospital settings already were trained in school to essentially wear personal protective equipment. But for them, we're not talking about blood stuff. They're talking about like respiratory spread. A couple last things. So you want to make sure that if you are using any equipment, you are only using it if you're trained on how to use it. You're making sure that you're reading and following all the instructions on equipment, reporting any damaged or malfunctioning equipment. And then oftentimes equipment is electrical. So just making sure that if you have an electrical cord, you don't want it to be frayed, you don't want it to be damaged, because those could potentially cause a fire or electrocution, things like that. A couple last things too. So you do not want to perform any procedures on patients unless instructed and properly authorized. So I know I have several students in my classes that plan on being registered nurses. If you know anything about nursing, you need to have authorization from a physician. So if you, and that's kind of a good thing because then they take the liability. But yeah, so if you don't have authorization from a physician, if you're a registered nurse, then you're not allowed to do something. And that just has to do with liability. And then if you plan on being a physician, then you're that person that's responsible unless you have somebody that is above you. You want to make sure that you're following HIPAA guidelines. So I talked about that when we went over the syllabus, but just a reminder, all patients have a right to privacy. So you can't go around and, share what someone in this room is going through unless the other person is also responsible for attending to this patient. You want to make sure that you're communicating with your patient if you're allowed to do so. So making sure that when you talk to them, looking at their ID bracelet. I obviously don't have that because I'm an athletic trainer, but I'm making sure that I'm asking them what their name is. Making sure that if you were to do anything, you're explaining what you're going to do to them. So like for me, I work in a high school setting. I have, and this is just an example, I work with minors. Let's say I need to do something where they might need a evaluation on their shoulder. Because they need an evaluation on their shoulder, I might have to like roll up their shirt sleeve, which if you don't tell someone, hey, I'm going to touch you, that could be kind of weird and awkward. So you just want to explain what's going on so that nobody is surprised. And then you always want to make sure that you're looking at your patients closely during your procedures. So vitals can change. A patient could be stable 1 minute and then heart rate could change, that sort of thing. So you're just making sure that you're looking out for anything that could, again, potentially change. And then you want to make sure that you're responsible for protecting yourself as well as others from injury. So that's where we talked about body mechanics. Again, making sure that you're lifting with your glutes. You're not straining your back. If you are required to wear a specific uniform, you're wanting to wear that as well. And then if you have any injuries, accidents that occur, you're reporting them. And so a big reason for this is so that there's documentation on what you did to basically correct the situation, and how did you take care of it, and then also making sure that any unsafe areas in your workplace are reported. So if you notice that there is an electrical cord that's frayed, if you notice that you don't have enough gloves to treat patients, so that's kind of where you probably remember hearing, if you watched the news at the beginning of the pandemic, a lot of nurses and medical workers were really upset because they didn't have adequate protection for themselves. And so if you don't have adequate protection and you get sick or you get injured or you develop some type of condition or illness, then you're going to be of no help to your patient. So again, it's important to obviously care about your patients, but your safety is always number one. And so you also want to make sure your areas are neat and clean. You're washing your hands frequently. And this even is before coronavirus. You should always be washing your hands frequently if you work in healthcare. If I ever provide first aid to a student athlete, if I'm ever doing evaluation on a student athlete, I'm always washing my hands before and after, because you could potentially have something on you as the worker that could be transferred to them. And then so that's why you want to wash your hands before, and then afterwards, they could have given you something as well. So just making sure you're doing it before and after. This is drying your hands thoroughly before handling electrical equipment. So again, you're trying to avoid any electrocution. If you are needing to wear safety glasses, you are wearing them, and then just making sure that you are observing all safety precautions. So at my end, I don't know if you can see this part, but in the parentheses, it says check scene. So I explain this to students like at the very beginning. And I'll just give this example because I think it's a decent visualization. So let's say you are a paramedic. You have a call for an accident that's on the freeway. You get out of your ambulance and you start approaching the accident. You're not checking the scene for safety and you get hit by a car. You're obviously of no help anymore. So I know that seems kind of morbid, but that's just in general. You want to look out for yourself. For me as an athletic trainer, oftentimes kids will get injured in the middle of a game. I need to make sure that that game has stopped, that the referees know that I am going to come on the field before I do so, because yeah, if they don't know and I just run out there and they're still playing, I could get tackled by someone. Bad things could happen. So again, you're always wanting to check the scene and making sure that once scene is safe, then you can actually go and approach your patient. And this is usually like in obviously non-traditional, non-hospital settings. If you're in a hospital setting, the likelihood of that happening is like it won't happen. But just making sure too that your area doesn't have like water on the ground so that you're not slipping and so forth. I think that's it actually. So that is the notes for today. Make sure that you scan them and then upload them onto Classroom. Please try not to take pictures of them unless you've already communicated with me as to why. Big reason is because of the fact that it is not as clear as a scanned document. So again, Cam Scanner is a good free scanning app. But any free scanning app obviously works too, just making sure that the picture is clear, I can read it, and making sure that your name is at the top. So you are free to finish these up and then submit them, and I hope you have a good rest of your day.